Hello, my name is Ashton and I'll be doing the trach care and suctioning video. So prior to coming into the patient's room, I was looking at the patient's EHR and MAR. I noticed that the patient's name was Mrs. Phillips. She's allergic to strawberries, bees, and she has no known drug allergies to any drugs. The patient has a tracheostomy, so she needs a trach care and suctioning. Prior to coming to the patient's room, I gathered all my supplies. I gathered my trach care kit. I gathered my suctioning kit. I have sterile gloves. I have a towel to place on the patient's chest, and I have saline. So I'm going to enter into the patient's room. Hello, my name is Ashlyn, and I'll be your nurse today. Can you please state your name and date of birth for me?
Sarah Phyllis, August 11th, 1997.
Can I just check your wrist? Okay, great. So, Sarah, we're in a safe and private environment. Everything here will be private and confidential. Do you have any concerns before we get started?
No.
Okay. So, we'll be doing a trach care and suctioning. So, this is going to help clear up any secretions or buildup that is in your throat. There is some slight discomfort when we're cleaning. Is that okay?
It's okay.
Okay. So I am going to lift the patient's bed up to a comfortable position to work on. I will raise the patient's head to a semi-phallus position and I lower the side railings. I'm going to assess the patient first before I do the trach care. I am assessing the temperature and it's 101.4. Respiration is 22. Pulse is 72 and her blood pressure is 128/88. I'm going to auscultate her lungs. So I'm noticing that her airways are clear, and there's no adventitious breath sounds. So I'm going to pre-oxygenate the patient, and I'm going to put it at 100%. And I'm also going to put suctioning at a rate of 80 to 120. So we're going to start off with suctioning. So I have my catheter right here. I have a sterile glove. What I'm going to first do is I'm going to get my saline and I'm going to put a little bit in another container, and I'm going to do hand hygiene and I'm going to don sterile gloves. Touching the inside of the glove only. And same with the other, we're just going to slide it on. Discard that. We're going to put that in the trash, and now we have our catheter. We're going to make sure to only hold the tip of it. Whatever is going to go into the trach with our sterile hands. I'm going to connect this into the suctioning tube, and I'm going to dip it into the saline just to clean the tube and make sure that the suctioning rate is at an appropriate rate. So I'm going to keep it in my sterile hand. I'm going to take the oxygen off and pull it to the side. And I'm going to take my catheter. I'm going to insert it 12 to 13 centimeters. And while I am taking it out, I'm occluding it and making sure it's 10 to 15 seconds. And we're sucking up all the secretions and mucus that may be in there. Now I'm going to go back into the saline, clean up any secretions or mucus that may be there. I'm going to put the oxygen back on while I do the cleaning of the secretions. Keep it in my left hand. I'm going to take off the oxygenation again. I'm going to go in 12 to 13 centimeters. And then while I'm coming out, I'm including it for 10 to 15 seconds, making sure I'm getting all the secretions out. Then putting the oxygen back on. Clean catheter with the saline. And now we're done with suctioning. So we're gonna put all that to the trash. So now what we're gonna do is we're gonna do our trach care. We have our trach care kit. I'm gonna first hygiene. And I'm going to open it. And we have a inner cannula, but we also have a towel in here. So this is gonna go on the patient's chest. That's for any secretions. While we're cleaning and doing the nasal cannula. So I am going to first get my saline, pour it into the tube. I have 2 cotton swabs right here, and I am just going to dip that into the saline. So now before I do the inner cannula, I'm only gonna wear clean gloves for changing the inner cannula. My inner cannula is right here. I'm going to take off the oxygenation. And I'm going to take off the old cannula. I'm going to throw that out. I'm going to get the new one. I'm going to put that inside. And I'm going to remove the gauze that's underneath. How are you feeling?
Okay.
Okay. So we're going to remove all that. So now we're going to be cleaning the stoma and changing the color. So first we're going to clean the stoma. And for this we need to have a sterile gloves on. So I'm going to do hand hygiene. Are you feeling any discomfort?
Oh, okay.
So I have sterile gloves. So now that we have our cotton swabs dipped in the saline, we're gonna go in and we're just gonna cleanse the area. So I'm just gonna go from the stoma and I'm gonna go from inner to outer. I'm gonna do the same on the other side. We're going from inner to outer. We're just from the least contaminated area to the most contaminated area. We're gonna take a gauze and we're gonna pat that dry. So now we're going to change the collar. We would usually have 2 people to help hold the faceplate down. So we're just gonna assume that we have someone here holding the faceplate down with me. So we have a new collar here. gonna take the old one out. And I'm gonna put so okay. So we changed the collar, so now we're gonna take a gauze and we're just gonna put it underneath. We're going to remove the towel. I'm gonna take off my gloves. I made sure that the collar is, I can at least put 2 fingers in. Can you move your side to side? Okay. So the patient's is able to move her neck and her range of for her range of motion. I'm gonna put the patient back in a comfortable position. I'm gonna lower the head of the bed. I am going to assess the vital signs again. I'm gonna assess oxygen saturation again to make sure that everything is within normal ranges. I'm gonna make the patient comfortable. I'm gonna give the patient a call bell in case they need any help or they need any assistance. And I'm gonna document everything in the EHR of the colors of the secretions, odor, and the patient's cooperatives during the procedure. I'm going to do hand hygiene before I leave, and that will be the end of the tracheostomy care. Thank you.
Thank you.